Good afternoon, Mr. Chairman. Members of the committee, thank you so much for allowing me time to speak. My name is Dr. Shaunette Parker. I am a psychology professor, the outreach director for My SC Education, board chair for Second Baptist Christian Preparatory School, an education advocate, and most importantly, a mom. As the parent of 6 children and a former K-12 educator, I have a lot of knowledge about the inner workings of various education options in the state, as well as several other states. I do have to add, because I wasn't going to put this in there, our children are sitting back there and my one son, and I'm just kind of hearing what people are saying about the difference between public school and private school. And it was very disheartening for me when my son, who started at the private school in 4K kindergarten and first grade, then I decided to transition him into the public school. And halfway through, he asked me if he got held back. He was in 2nd grade when he went to his public school, thought he got held back because all the work that they were doing, he learned when he was in kindergarten at the school. And so after trying for 2 years of sending him there and of him being ignored quite a bit, we sent him back to his private school, so he's been quite successful. It's about choice. And about a year ago, I stood before a similar committee asking for unanimous support of an ESA bill, and today I am before you asking that you support House Bill 3976, because we need to expand access to education choice options in this state now more than ever. I'm sure you would agree that a lot has happened over the past year. Many families have been challenged by devastating losses. Our social and political climate is frighteningly unstable, and many children have fallen further behind academically. And while some will try to argue that COVID will be the reason for low academic achievement in the next few years, I contend that COVID has only exposed many of the problems that already existed. And I won't run down the list of our issues with education in our state. I'm sure you are aware of the problems and the disparaging statistics of low achievement rates. What I do want to say today is to ask you to think about solutions. And I want you to notice that I said solutions, indicating that there are many ways to address the systemic education challenges we face. I am a community psychologist, thus I believe in addressing issues from an ecological perspective. This means that we have to look at multiple factors when problem solving and work to provide several interventions to work against prevalence and incidence of an issue. I find that the best way to address the varying complex challenges our youth face with education is to provide access to more options. We live in a society in which we are able to choose where we shop, where we eat, where we worship, and even receive health care, but for some strange reason, access to K-12 education options are limited, and I think this is quite hypocritical. We live in a capitalistic society that encourages trade and industry controlled by private owners for profit, and to become one of those private owners, you must put yourself in a position to be able to work hard and achieve by your own merit. But the first step to putting yourself in a position to be able to compete in our ruthless society is a good education. And actually, it's about getting a stellar education, or at least one that gives children the soft skills they need to put themselves in a position to pull themselves up by the bootstraps so that they can have enough economic wealth to get what they need and want out of life. And if anybody notices any hint of sarcasm in my voice, you are listening well, because meritocracy is a myth, and opposing access to education choice options means you believe in this myth. Show me the successful business person who hasn't benefited from a successful family legacy, or perhaps a talented network of friends, or connections to a prestigious institution, or maybe even early exposure to the right information, and I will show you the mythical unicorn. Whether you have extensive knowledge in child development or not, I am sure every adult in this room knows the risk factors many South Carolina children face. Factors such as being born into low-income households, living in neighborhoods with limited resources, and even being a person of color. Yet we all wave the education flag, exclaiming that a good education can break cycles of poverty. If that is true, why aren't we recognizing that what we've been doing all these years is slow moving and isn't pushing the needle toward widespread success? I applaud the youth who have been successful in just the public school system. My older 5 children all went to public school, and despite some of the challenges with that, I am not against effective public education. However, as a college professor, I can attest to the fact that just because students are getting accepted into college doesn't mean that they're ready for college. So what about the children who aren't successful? What about the children who need something different? What about the children who come from families in which they can't afford that something different? To me, saying no to an ESA program is like telling children and their parents, we don't care that you need something different. You just need to tough it out in the school that you've been assigned to and wait for us to develop school improvement programs and other programs that take years to fully get going. Never mind the fact that there's another option in your community that could help you right away. It's your mom and dad's fault that you don't have the money to pay for another program, even though they're working really hard to provide for your family, and they're just on the same cycle that you'll be on because you won't get the services that you need either. Saying no to an ESA program ignores the need for equity. Saying no to an ESA program means that you accept the fact that our education system is doing what it was designed to do, systematically ignore students with learning differences and those who were historically disenfranchised students. Saying no to an ESA program ignores the differences in our children. So in closing, I ask that you consider this. I'm sure that many of you have had doctors who say you need to eat and maintain a healthy diet and eat plenty of fruits and vegetables. When they say eat fruits and vegetables, they don't mean eat the same fruit and the same one vegetable, because you won't receive enough vitamins and nutrients for your body. You need to have a wide range of fruits and vegetables. And perhaps if you're like me, you've discovered no matter how many fruits and vegetables you eat, you need to take supplements because you're just not absorbing the nutrients well. And later you discover that you're actually allergic to one of the vegetables that you've been eating for years, even though you've been told that it's good for your body. So your body rejects it. So naturally you stop eating that vegetable and you try to find something else that can give you some nutrients without the allergic reaction. Perhaps we should think of our children's education in this way. An ESA would allow children to get the prescribed balance of education that works well for their minds and bodies. An ESA would allow parents to find supplemental resources to add to the education they are receiving if they aren't just getting enough of what they need. Moreover, if at some point the source of education is no longer working for the child, you stop using that option and find something else that can give them the knowledge without the adverse reaction. ESA opens up access to education options, and I do believe that our children are worth it.